Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, welcome back, Richard Lawhern, patient advocate. Today's Kevin MD article is Why Psychiatric Overdiagnosis Fails the Students Who Suffer. Richard, welcome to the show.
Thank you very much. I appreciate the opportunity to speak with an audience through you who are at least equal parts, probably more than equal parts, clinical professionals, journalists, and healthcare patients. I am, as you're aware, and as many of your readership are aware, I am a healthcare educator with about 3 decades of experience in the field and somewhat over 400 published papers. I maintain a very large network. It's a way of being aware of what's going on in healthcare. And the network popped up with an article recently on the Boston Globe by a gentleman by the name of Adam Omery. Adam did an article titled The Disability Accommodation Trap on College Campuses.
I think I read that article.
It was quite well done and well referenced, as a matter of fact. And what he basically wanted to communicate is that, as was reported in the Harvard Crimson in December of last year, the share of Harvard undergraduates receiving disability accommodations rose from roughly 3% in 2014 to 21% in 2024, which was a 7-fold increase in a decade. Now, for me, that observation and his further commentary was a little disturbing, because 40 years ago, one of my daughters was among that 3% or less who were diagnosed with a disability, specifically dyslexia. She had inherited dyslexia from her grandmother through me, but it had skipped my generation, and I was not really certain that the label would have applied. When it was discovered, she was homeschooled by her mother from 6th grade through high school, admitted to a junior college, and then to upper division status at a branch of the University of California. And she was one of those who benefited from what are now called accommodations. She was granted extra time in some of her examinations and was exempted from reading aloud in some of her classes. Those were not large accommodations by any means, but they were part of her educational program. Now, when I read something like the article by Adam Omery, I am particularly alarmed because I think it may cast incorrectly a shadow over others like my daughter, who are very bright, but simply have a disability in the way they process information. She was a very bright lady. She, in fact, graduated from the University of California cum laude in English. And when she left her employment 12 years later to start her family, she had served as an assistant vice president for network services at a multi-branch community bank. In fact, not only had she served in that capacity, she was at the time an assistant network administrator for the Federal Reserve Bank in San Francisco. Now, you don't get to such positions by patronage or by being dumb, that's for sure. She's not a dumb lady, she's very bright. But Dr. Omery offers a very important context for the article. And on this, I'm going to quote him. No one wants to be accused of indifference to suffering, but overdiagnosis is not compassion. It teaches a generation to mistake the ordinary difficulties of being young for evidence that something is clinically wrong with them. And it dilutes resources and attention and takes attention away from the people who need them most. And as a healthcare educator, I am entirely in agreement with this observation. But I'm also going to suggest that Omery did not take his observation quite far enough, because this article is occurring in the context of an enormous, I think you could say, earthquake in public perception on the entire fields of psychology and psychiatry. Those fields are now in crisis, and it's a crisis of credibility. And they are in crisis for very good reasons that most people are not generally aware of. And let me quote again from a few other sources that suggest this. Let us take a for instance. One of the books that was very formative for me was published, let's see, something on the order of 1973. I'm going to say that it was at 73. It was by Martin L. Gross. And the title of it is The Psychological Society, The Growth and Failure of Modern Psychology and Psychiatry in the Psychological Generation. It was a very startling book because, among other things, it summarized studies that went as far back as the 1950s that demonstrated a very alarming characteristic of psychiatric treatment in institutions. Specifically, it reported the results of several studies that did a kind of double-blind analysis on the effectiveness of several types of psychiatric therapy in resident facilities. A group of patients were separated into two subgroups. One of those groups was admitted to resident status for 6 months was basically to a bed at an institution based on an evaluation that suggested that they were in some way profoundly depressed. That group was in turn divided into three groups. One of them experienced Freudian psychotherapy or psychoanalysis. Another was experienced Adlerian psychoanalysis and work. That group, after 6 months, was asked, has your depression improved? And 90% of the group reported that yes, indeed it had. There was no significant statistical difference between the three forms of therapy. But here is the real kicker. The group that was waitlisted was also asked the same question, and they gave the same answer in the same prevalence. 90% of those who were waitlisted suggested that they too had significantly improved in their levels of depression. We really need to think about that in the context that Omering has established, because what that observation, among many others, is telling us is that the people whom we trust to assist our youth and to assist us old folks when we feel we need it, in dealing with depression, in dealing with anxiety, in dealing with issues that basically hamper our ability to live and to enjoy lives of something other than quiet desperation. Those people have not made the case for their methods. And this is not the only issue that arises. As I mentioned in the article that we're working from, anyone who is going to potentially study this field also needs to study some recent efforts by analysts to evaluate whether the studies that are considered to be seminal, and by that I mean really game-changing, in the practice of psychology and social psychology and psychiatry, we need to consider whether those studies hold up when they are reperformed by groups different from the groups that originally performed and published them. Now, by any other name, this is called the quote-unquote replication crisis. And it is a crisis because what it reveals is that when teams of investigators attempt to duplicate the results of the original studies that go back probably 20 years and more, and which have shaped the entire practice of psychology, psychiatry, and social psychology. When groups tried to do that with 100 studies, in 65% of those studies, the results didn't replicate. In other words, using their best understanding of the trials protocols that were used in evaluating these methods, the independent study group arrived at the understanding that the studies really were not supported by the data that was processed.
Mm-hmm.
They just didn't replicate. And worse, even among the approximately 1/3 of studies where there was some replication, the statistical significance or strength of the finding was much lower than claimed by the original investigators. Omri's article illustrates that resources are being misallocated
Mm-hmm.
for people who probably would do just as well without them. It also suggests that we may be crippling an entire generation of people by subjecting them to favoritism with the best of intentions and essentially subjecting them to proposals about the nature of human psychology that are simply false. As a clinical educator, I see this operating in a different framework all the time.
So, in terms of the diagnoses that Omri writes about, you are implying that some of them then, not only because of the historical context of psychological studies, that those diagnoses that some students are getting may be in question.
Yeah, I think they're more than in question. I think that students are actively being handicapped by overdiagnosis rendered by psychiatric and psychological professionals. Now, this is a general statement about a problem that has great many dimensions to it. But one of the things that we're realizing now is that the people whom we trust to be experts on the management of life difficulty, which is really what a psychiatrist or a psychologist does, the people whom we've trusted are not worthy of that trust. We have facing us the likelihood that an absolutely huge number of studies that have influenced the practice of psychology and psychiatry need to be burned to the ground and done over
Mm-hmm.
by a different team with different assumptions, and a team that bothers to check its own results by doing a step-by-step analysis of methods before they ever go to print. There are families who have reason to believe that their kids have been actively injured by misdiagnosis.
Mm-hmm.
There are other families who are really desperately seeking help that psychiatric care probably isn't going to give them. They might do just as well working with a life coach.
Mm-hmm.
They might do just as well working with someone who is certified as a marriage and family counselor. And counseling is a very different operation than psychiatric care because it
Now, there
does
must
not
be
involve.
some data that shows some of the benefits of some of these psychiatric studies. Are you just putting them all in one bucket?
So far, and this is one of those places where I have to say, as far as I know, nobody has put the whole thing in one bucket yet. The closest I've ever seen was Martin L. Gross, and he did this particular job now 50 years ago. His book, by the way, is still available as a used book from Amazon. You can look it up. Martin L. Gross, The Psychological Society. The point I'm trying to make, and the point that I hope that other people will regard, is that there is a counter-revolution brewing now. And it's brewing among others, among people who have excellent credentials to be critics of the current trend. One of those people is a fellow by the name of Alan Francis. He was basically the crew chief who supervised the development of the Diagnostic and Statistical Manual, version 5. He is also one of its sharpest critics. And the book that I suggest that people consider that he authored was Chasing Normal. It is a fascinating look at the tendency to over psychologize normal adjustment issues that we encounter in adolescence and young adulthood and older adulthood as well. Because what he says is basically The DSM-5, as the standard that is used in diagnosis, essentially expanded the range of possible toxic diagnosis significantly without in any way assisting in generating better health, mental health or otherwise. And from someone like Alan Francis, who is certainly qualified to make that judgment, this is a very damning indictment, and it's one that should prompt public health policy change and action. We need to seriously reconsider a great number of the published papers that are used to justify therapies for young people that probably don't work any better than a wait list.
Now, can you tell me where we go from here? What are the plausible paths forward?
One of the possible actions here is that families that have had problems with a child not getting appropriate support, they have a basis for legal action. It's a rather tenuous one. But families where a child has suicided while under treatment have an excellent case for requiring that a state board re-examine the credentials and practices of the treating physician in those circumstances to assess whether, in fact, he was using methods that, in fact, work. The state board process is set up to do that, both with clinicians who treat pain and with psychiatrists and psychologists. But people whose families have been damaged by these kinds of influences have a definite, I think, potentially highly effective means. I haven't yet seen evidence that the lawsuits are happening, but I think we're right on the hairy edge of a wave of them that respond directly to the kinds of influences and issues that are raised in the Boston Globe just a few days ago.
We're talking to Richard Lawhern, patient advocate. Today's Kevin MD article is Why Psychiatric Overdiagnosis Fails the Students Who Suffer. Red, let's end with some of your take-home messages to the Kevin MD audience.
Pertaining to this article, we are very much involved in referring people to competent physician care who need it. And we will make every effort to be sure that anyone who contacts us requesting that kind of referral is treated on a priority basis.
Richard, thank you so much for sharing your perspective and insight. Thanks again for coming back on the show.
Thank you for having me.